Right, good evening, everyone, and welcome to the committee meeting this evening. And I'm chairing in place of Mandy, our chair, who's away today. I will start by taking any apologies for absence.
Yes, thank you, Chair. Apologies today, as I said, from Councillor Mandy Evans and also from Councillor Alan Jeffrey. Are there any other apologies? No.
I don't see any hands on the screen, so that's okay. The next item on the agenda is disclosures of personal and prejudicial interests. Anybody around the room? Nope. On screen? Nope, none. Okay, so we move on now to approve and sign the minutes of the previous meeting as a correct record, and these are on pages 1, 2, 3, and 4. Do we move the minutes?
Show of hands if everybody approves them.
Anybody has any issues? Yes. No. Nope. Somebody's got. Has Councillor O'Connor, have you got your hand up?
I think she was just doing it to approve the minutes.
Ah, okay, just to approve the minutes. All right. Okay. So do we all approve the minutes? Yes, yes, yes. Thank you very much. Okay. Our first topic of discussion today is the early help model. And to lead on that is Amy. Amy here. Right. Over to you, Amy.
Good afternoon. I'm not sure if Councillor Hayley Gwilym wants to say anything in terms of her portfolio of prevention and early help and area coordination. Yeah, she's not in. Thanks.
Yeah, thanks, Amy, and thank you, Chair. Yeah, just a brief introduction from myself. Obviously, as we move towards, early intervention and prevention as our target operating model and offering more services at an earlier opportunity, we're asking the committee for their input in shaping this work as we move forward, because this is, in its infancy. I know that we have recently appointed an early help principal officer manager now, Sue Parage, who's got an extensive experience, because we've actually stolen her from Child and Family Services. Their loss is our gain, and I know that she's going to bring some a lot of learning that she's had from her role now with them. So it's an exciting way forward that we're moving and are transitioning to. And whilst it's going to be a different offer for people, it's actually the right thing to do for them. So I'll hand you over to Amy and to Sue to take you through the report.
Prevention and early intervention is one of the principles of the Social Services and Wellbeing Act to increase preventative services in the community to minimise the escalation of critical need. So just in relation to the current picture, the demand for social care is increasing significantly. It's exceeding the available resources, and during 2024-25, there were 5,096 new contacts into adult services. Demand is rising and cost is rising, and the future forecast is that will continue to do so unless we do something different. In line with the adult services targeting operating model, what we want to do and what we are doing is shifting resource to bolster the enabling communities, the prevention and wellbeing and early help, which is a new area, which will hopefully reduce, and we're very confident in saying this, hopefully reduce the demand on managed care in many different ways. So the approach will see an increase in preventative activities and short-term early help interventions, which will focus on current demand with a view to reducing those who need long-term managed care through reviewing, reassessing and refitting and resizing packages, whilst continuing to offer statutory services. So as Councillor Gwilym said, there's been a significant investment in a new team, the appointment of myself, Sue Peraj, Early Help Principal Officer, 13 years in Child and Family as Service Manager for Child and Family Early Help. Alongside my appointment, we've made a new appointment in the third sector, a new Early Help Strategic Lead has been appointed along with a commissioner lead internally. So the new early help area will be made up of existing staff. So we've got the information advice and assistance staff in the common access point, the sensory team, alongside the area coordinators and community wellbeing officers. But as I mentioned earlier, we've had significant investment to create new posts, which will involve early help lead workers. So the offer will primarily include information advice and assistance and referrals to community-based partners and commissioned services, assisted technology and equipment, assessment and the development of wellbeing plans and short-term case management, hospital discharge to support people to access short-term community-based support and help them sustain and remain at home. And where required, early help can refer into the rapid response social work team to address crisis or where long-term managed care is needed. The basis of the support, as is now, enabling communities and community capital and asset building still remains very focal, where we want to draw and expand on existing collaborations to extend existing networks of support, whilst also facilitating new community-led initiatives that promote and maintain independence. And when care is provided and needed by the local authority, then we will continue to do that. So some of the new steps that you will see emerging over the next months or so, we will work towards a shared vision where stakeholders will sign up to the same approach, where we are aligning the way that we work. We're going to be recruiting new early help lead workers into post. We're going to be strengthening public awareness around the early help offer. We're going to be developing new timelines for recommissioning activity to maximise on alignments. We'll be co-producing with our partners on existing and new pathways. We'll be developing a new early help performance framework for outcomes and activities. And we'll be evaluating early help pathways and cost using the data that is existing and new data development. And we shall be implementing a quality assurance framework which will be aligned to our targeting operating model. Has anybody got any questions?
Right. Thank you very much for that report. The report is actually for our information only. However, I'm very sure that the team will appreciate our input. As you can see, that this is still very early stages of the work, and from the next steps, we see that there's quite a lot, ahead of this report. So any input from ourselves would be very welcome and very useful. So I will take questions at this time. Councillor Walton.
Yeah, thank you, Chair. Thank you very much for the report. Fully support this idea. I think it's not just going to help your department solve the issue of increasing demand, but I think also people who are on the receiving end, they want to stay as independent as long as possible. And the earlier you can get help to them, the longer that is probably going to carry on. There's one question I wanted to know, maybe if you could give a bit more insight as to how you're going to get public to be aware of this scheme, because it's well worth it. And obviously you need people who might end up wanting to take up this offer, they need to know about it. So I'd be interested to know if you've got a little bit more meat on the bones about that. Thank you.
Yes, so in relation to how we're going to spread that message, we do have a significant number of staff that are already located in communities. So our area coordinators are in all of the areas in Swansea, so they will play a significant role in the promotion of new messages and what's on offer. We'll be using our public and digital platforms, so we will have front-facing messages on our web pages. There'll be use of social media. We will be strengthening our existing partnership working arrangements with people like GP practices and cluster arrangements in terms of health. We've got Roxanne Dacey, who's been appointed as the strategic lead for the third sector. So we've got opportunities to share those messages in their various forums and platforms. So we're quite confident that we've got a wide and far-reaching opportunity to share those messages and shape the way that we want to go in terms of future for early help.
Thank you.
Does that answer the question for you, Councillor Walton?
Yeah, that far more than I thought would be the answer. So yes, I'm very pleased with that.
All right. Just before I come to you, Maya, sorry, I think Hayley has something to say.
Yes, yeah, just to add a little bit to what Sue Parage just mentioned as well, I think us as councillors also have a role to play in getting that message out. I mean, we are very much in our communities. You know, we've got the one-stop information shop as well, which I'm sure the team will attend. So there's you know a bit more to it, and I hope that we have buy-in from councillors who will commit to that as well. Thanks.
Councillor Baker?
Lovely, this is great. This is going brilliantly. I can see it from up our area, up in Blaenau Maes. I know a few of the young ladies I know up here use the Early Help Hub, and they said they have achieved so much independence, like looking at what to cook the children when you're in a rush, looking at every aspect of that child's life, and which has pulled that mother to realise where those steps she has gone wrong. And it has helped. They said that it has helped. And there's a few other tenants that could do with this Early Help Hub up here, the help from the hub. And I was wondering, just as Hayley said, as councillors, could we put referrals forward? I've often gone in the hub because I've had a few things on parking, but it's nothing to do with this project. And I find them very helpful. And you couldn't ask for better staff. But I would like to know if we could refer a tenant who has got young children, it needs the help, but don't know where to go. Not on the internet, perhaps, or can't read and write properly, and don't understand the concept of the Early Help Hub. And it's very frightening then if they do not understand. If us as councillors could have a little booklet to say, oh, I can give you the information, this is the information, and read the booklet to them. I think that would help a lot. And if we could put them forward then to the Early Help Hub. That's all.
Yes, you would be able to refer, and yes, people can self-refer as well.
Brilliant, thank you.
Councillor O'Connor?
Hi, thank you. It looks good and it sounds good. I guess for me, it's whether or not it all will work in practice, and I guess whether there's the budget to enable more staff and more expert staff if needed. I suppose when people contact you needing this help and the intervention, no one knows when anybody's going to need it, and when they need it now. And so it's how quickly will the early help be able to then pass over to get the next steps, to get the appointments that may be needed, to get the plan in place to help them, because obviously they don't want to be waiting a long time because they need it now.
Yeah, I totally agree. And in relation to that, we have considered that we will, without making it sound too complicated, we will have a short-term assessment team. So the assessment team will be able to rapidly respond to need. Where needs are more complex and long-term, those adults would be supported by our area coordinators in those roles. So we'll have the flex between the two teams to be responsive and short-term intervention, and where we can, then we'll pass it on to the area coordinators for longer-term intervention. So we're very mindful of that. That you know, there are significant waiting lists for lots of services, and we just become the same if we don't find a model that fits.
Also, just on the area coordinator role, and I guess any other similar role, and obviously different wards are different with the amount of cases that they may have. Is there kind of a maximum amount of case load that each coordinator can take on? And then if they get full, then there will be somebody else that can take over. I'm just thinking because some may be weighted differently.
Yeah, so within the early help team, you know, there's a greater capacity. So the hope would be, yes, all the early help workers, you know, some areas are busier than other areas, but we are considering Swansea as a whole, and there will be a flex within that to where the areas have greater demand over some areas that maybe don't.
Yeah, okay, that's good, thank you.
Councillor Evans?
Yeah, thanks, Chair, and thanks for the report. I've got two questions. I realise how in this early days with this work, so please feel free just to bat it back if you need to. But the first question is about what's described in the report as how we're evaluating the model around the satisfaction tool and measuring wellbeing outcomes achieved. So my first question is, what outcomes are we talking about and how are we measuring them? And the second one, again, if it's, you know, it's early days, so if you want to just bat that back, that's fine. But the second question then is, what are the risks, if there are any, what are the risks to the council of moving to this model? And are we confident that we've got the right plans in place to mitigate them?
I'll take the first question. Amy's going to answer the second one. So just in relation to the outcomes, so there'll be a significant new data development set happening to capture some of the hard data, so the number crunching stuff. And then there are the social services and wellbeing outcomes and the HSG housing support grant outcomes, which we need to capture for grant compliance. And they are a distance travel difference made measure. And there is a customer satisfaction survey that will follow and capture some of that. And then as we evolve and when we learn going forward, I'm sure that some of those measures will change, but to start with, they are social services, wellbeing outcomes and HSG.
Shall I just come in on the risks, the council? Yeah, like any new initiative, we will be, or we are already risk assessing different aspects of it. So we've got a risk around to the council if we don't apply a different approach such as this or an investment in this area, both in terms of the teams and our financial resource we're putting into this, because we know that, as Sue mentioned right at the beginning of the report, the demand is increasing for our managed care services. It's higher cost care. It's getting to people later. There's potential for waiting lists, potential that people can be deconditioned. So, you know, they're not promoting their own health and well-being. So we know that that's a risk if we don't apply an earlier approach. So having more investment and more resources earlier on to support people earlier. I think there's as Sue was just mentioning around the evaluation and that ensuring that we're meeting the outcomes, it's a risk as well that we need to make sure we're measuring what matters and measuring what matters to individuals and to ourselves as an organisation and to our partner organisations. So I think in terms of the risk, that performance framework is going to be really important to us. And I think there's also work aligned to this, which is in the report as well, but we're just making sure that we align this to using the data and evidence to ensure that the financial investment we're spending in this space as well is proportionate to the individuals we're supporting as well. So these are the areas we're looking at. I think there is something around our partnership working as well. That's why we see the stakeholders signing up to this has been really key, because I think that's a risk area that if we don't have that buy-in from partner organisations to make sure we've got those referral pathways so the right organisation is supporting someone at the right time. So I think that's really key. But all this is in our implementation processes around the risk. I hope that goes some way.
Thank you.
Oh, any other questions from anybody? Nope. Yes, go on.
Yep, great questions from the committee, and I guess it's the nature of this committee, isn't it, to be directly involved in transformation and new and emerging work. And this is a great area because whilst we have a history of delivering prevention and well-being, this is the launch of a more coherent, robust, proper invested in, with risks attached if we don't get it right, because we are investing. If we don't get it right in the way that I think some of the questions pointed to, the danger is we're doing more and more of this, but we've still got more and more of the more challenging outcomes of more and more people needing care, and then it becoming unsustainable overall. So a really important area for the council and this committee and councillors more generally to be really interested and involved in. So I've jumped down off my soapbox now. I suppose that what my question to Sue and a challenge perhaps to the committee is, are there opportunities going forward? It's great to receive a report and ask some questions, and I'm sure you'll come back to this from time to time, but will there be opportunities for members of the committee and potentially ward members to become directly involved in shaping things going forward? So when we talk about we need to do co-production with partners, we're going to need to do something about communicating a different offer with our population, but also different expectations of our population to promote their own health and well-being as well. Will there be opportunities for members of this committee in particular, but potentially ward members more generally, to get more involved in shaping some of that stuff? Can we create those opportunities? Can there almost be a standing offer? If we're going to, I don't know, if we're going to hold a public event, we'll definitely invite the members of this committee. We'll definitely invite ward members if something's happening, particularly in their area, that kind of stuff. Or are there other standard things that committee members should be, I don't know, linking with their local area coordinator or their early hub team that's operating those sorts of mechanisms? What's our thinking about that kind of stuff?
So in terms of area coordinators being a role in a much larger early help team, then I'd like to think that those opportunities are already existing. The area coordination has been around a long time. We're moving into early help, so the landscape is going to change as such. But I believe, my understanding is, I've only been in post 9 weeks, and maybe people will tell me different in the room, but those opportunities are already there for people who want to be involved. Obviously we need to grow an early help model that ultimately matches the needs of the community, the people themselves. So we need to co-produce with those people, because if we get it wrong, then nobody will come along and we won't intervene early and we won't prevent anything from happening. But I'm open to any opportunity. So if there is anybody that wants to get involved where we can add value to each other's agendas and we can streamline, then absolutely yes. But building on what's already out there, I think that is the approach that we've taken anyway.
And I think that from a committee member's point of view, just the fact that we've got this report in front of us is an opportunity for us to get involved in whatever way that we can get involved, whether it's in, getting the message out there, or it's in making the connections between, officers and some of the community groups in our wards. And, that kind of brought me back to how I was going to sum up, the discussions on this. I'm particularly pleased to see that co-production with partners is part of this. And this is where we all come in as stakeholders, whether we're committee members, with third sector organizations and other groups out in the communities. What I would really like to see, and I would be, particularly happy to be involved with, is the stakeholder bit of it. A bit more partnership with third sector organizations, a diverse set of groups getting involved, in the whole project, because that helps us then with particularly cultural understanding, because this is some of the feedback that we get, in the wards, that lack of cultural understanding from specific communities out there. So it is indeed an opportunity, and I'm sure I speak for other members of the committee, but I see again that Councillor Walton's got her hand up, and Hayley wants to come in as well. So I'll go to Councillor Walton and then come back to you, Councillor Gwilliam.
Yeah, thanks, Chair. I was just coming back again about communication. I think that I'm very pleased, like you, the phrase co-productions come in. And I definitely think that this committee does need to perhaps have a role, particularly in making sure we all are saying the same message and getting out the correct information. I'm more than happy as a councillor to promote this, but I want to make sure I'm saying the right things. So I don't know whether there's going to be a leaflet produced or a poster or whatever, that kind of thing, which then all of us can see and read and buy into and make sure we're all giving the right message. Thank you.
Thank you. Councillor Gwilliam.
Yeah, thank you. I was going to raise two things, and I'll go back to the second one I was going to mention, but Leslie just highlighted really is that I'll make sure that the right information is passed on for child and family early help admire, and also this adults services as well, and how you refer in, but also the types of referrals that are accepted. And then the next bit that I was going to mention is that's why I think Dave Howes was alluding to this as well, is, you know, the next steps. Are they the right next steps? You know, what are the committee members' voices or opinions on, are the next steps the right ones, the right direction that we're going in? So that would be really helpful from my perspective.
Thank you, Councillor Gwilliam. That's very helpful indeed. If there are no further questions or comments, it's just left for me to say thank you very much for that report. And we will move on to the next report, which is the When I'm Ready report. That would be either Julie or Helen.
Yeah, Helen will present. I didn't know if Hayley wanted to, not Hayley, Louise wanted to come. But just before we move off the topic of early help, just to clarify that if referrers referring in for early help support would need to get the consent of the family before putting the referral into Child and Family Services, because without their consent to refer into early help, we wouldn't be able to action that. So I'm sure that will be information that Hayley shares, but we do need the consent of the parents to actually action that referral that comes in for early help. Just to clarify. So Louise, I didn't know if you wanted to say anything before I hand over to Helen.
Kerry's got his hands up. I think he wanted to come in. Sorry, just.
Thanks, Louise. So sorry, guys. I just wanted to seek advice. Just if sorry, I hadn't read When I'm Ready was on there. I don't know whether I need to declare an interest, because I'm the director of the Roots Foundation Wales, which obviously we have children leaving care living with us in Roots Foundation Wales, obviously funded by Swansea. So just before you start, is it just, which kind of declaration is it? Sorry, I should have said this beforehand.
Would that be personal or prejudicial?
I can't hear online. Sorry, what the advice is.
So you'll have to consider, councillor, whether that's whether you consider prejudicial to the report for you to stay in the meeting.
We're not making a decision, are we?
No, if it's personal, then, but as I say, and you'll have to make the decision as to whether you think it's prejudicial or not. If it is, then you'll have to leave.
Okay.
But being as it's a steering group.
Yeah.
Okay.
In my opinion, I don't know. Do When I'm Ready arrangements work with Roots? I don't know if it works in the same way. Does it? No, I don't think so.
Yeah, I mean,
I've probably
that is some. Yeah, that's something, councillor, you'll have to decide whether or not you think that your directorship is prejudicial or not. Okay. I can't answer that. You'll need to decide that for yourself.
Okay, thank you. All right.
Thanks.
You can carry on, Councillor Gibbard.
Oh no, thanks. All I was just going to say is yeah, it's a good opportunity. This is we're refreshing our policy of when I'm ready, which is one of the ways in which we young care experienced young people can stay with their foster family past the age of 18 with their carers. So I think we've got Amy online as well, and Helen and Julie in the room, so happy them to take us through the report. And I think the main thing is it would be great to get the committee's input on again how we share this information. Is this the right approach? And hopefully, you know, it's a really useful piece of work. So I'm glad to share it with you.
Thank you. Okay, so I'm just going to take you through sort of the highlights from the report, and as Councillor Gibbard has highlighted, myself and Amy is on screen, who's the team manager of the Bays Plus service, so we would be happy then to take any questions related to the report. So the ask was to share an overview really as it stands at the moment in terms of when I'm ready, and to just share some of our thinking around some changes that we are proposing to make to the scheme. So just to give a bit of an overview, brief overview. So under the Social Services and Wellbeing Act, we have a duty as a local authority to provide support for young people to remain with their foster carers, to remain in their homes ultimately beyond their 18th birthday, so in post-18 living arrangements. So what is important, or to make a distinction with this arrangement, is this is no longer a care arrangement for a young person. That young person would then be an adult. This becomes more of effectively a tenancy, for want of a better word. They would remain in their home, but the expectation would be that the onus is on support as opposed to care. Young people would therefore be expected to contribute and to live as independently as possible within that environment, with a view of moving on at a time that is right for them. So the When I'm Ready provision allows young people to stay in their homes up to the age of 21 or beyond that time if they are in education or training that takes them beyond their 21st birthday. So it's a really important scheme, and it's a scheme that as a local authority we promote and really encourage, because it does allow young people that opportunity to have stability, continuity in terms of their accommodation, and it means it's one less thing for them to be concerned about if they are trying to develop skills or training to move them into their adulthood. It also allows them a place where they are safe and that they know in order to build those independent living skills. So it is really, really important for young people. Any young person who is any care leaver post 18 will have a young person's advisor. So that team is based in our Bays Plus service. So every young person will have somebody that is supporting them and helping them to move on into independent living. That support is essential for young people, particularly when they may be approaching 18 and may not have a full idea about what they want their future to look like. So we try to provide as much support as we can. They also have access to financial support through their young person's advisor, and also through benefit support. We would try and determine what they're eligible for and provide them with as much support as we possibly can. The changes that we are seeking to make are based around the financial element of the When I'm Ready schemes. The scheme in and of itself works generally. Young people give us really positive feedback in respect of it, and our foster carers also give positive feedback around wanting to continue to support young people. However, financially, it can be quite a significant change for our carers moving into being providers. So as it stands at the moment, we have a two-tier process. So we have an enhanced rate and a standard rate. All of our When I'm Ready providers start on the enhanced rate. So we try to provide as much support as we possibly can. And then that reduces down to the standard rate. that jump, I guess, can feel quite significant when they've come from a foster care or allowance, that then reducing down. The purpose of this, just to reiterate, is that we are helping young people move to independence. It isn't a caring role, and that's the particular difference in this. But it can be really challenging, and we do, when we have feedback from our providers, that is often one of the things that they will raise as a significant challenge. So in order to address that, we've been considering what that could look like if we moved forward in a slightly different way. And what we're proposing is to have a shift to a single payment range, a single standard payment. Our hope would be that we would bring that more in line with a fostering allowance. However, again, it isn't a fostering allowance that they will be eligible to. So we want to raise the lower level and just provide one standard amount. The purpose of doing that is that we can then have a consistent approach to how we're financially compensating our When I'm Ready providers, avoid any confusion and any disparities in pay, which is what we are currently having in terms of the feedback, and hopefully engender trust from our When I'm Ready providers, and help our foster carers understand that if they are going to go into the scheme and take this on, that they understand exactly what that is going to look like for them. It will also enable us to streamline our financial process. It will help in terms of our administration of that, so we won't be, so we can minimise delays or hopefully avoid any errors in payment, and that will be extremely important for us moving forward. It enhances placement stability, which is really, really important. Some of the feedback that we have is some of our foster carers feel that actually When I'm Ready isn't something that they can consider on the basis of financial contributions. So the hope is that this will enable us to have these discussions at an earlier stage with foster carers and hopefully maintain that stability for young people. It will also enable us to have clearer financial forecasting, which is really important. We'd have an indication of how many young people would therefore be able to access the scheme and what that would look like for us as a local authority financially. We have, in order to sort of come to this conclusion, we have spoken to When I'm Ready providers, so we know that this is an area that needs to be, ideally needs to be addressed. But generally, this is a scheme that is really valued not just by us as a local authority, but by our care experienced young people and those that provide care to them. In terms of the financial implications, we are currently in the process of confirming the costings and what that would look like. So obviously, until that has been finalised, we haven't got a full assessment of the financial impact at this stage. This is in process, and obviously we will then follow the appropriate channels to ensure that that is agreed moving forward. So if there's any questions at this stage, be open to taking them. Thank you.
Right, thank you very much for that report. Again, another very important one that really needs our input in the way that we shape the lives of, people who've been in care after they turn 18. And as I was saying to the cabinet members, in an earlier meeting, for me, the added benefit to that is the fact that I think it would reduce the pressures of housing as well, because there's an alternative for these young people. So it is a welcome report. There's no hand up now, so I've got a question, and it's just to gain some more clarity around the transition, in the rates. So am I right in thinking that the people who are already on the enhanced rates, the providers there, remain where they are, and those who are in the standard ones will then transit to the new standard rates, but that doesn't quite phase out the enhanced rate, does it? It just creates a balance between the two rates. I don't know, I'm just a bit confused around that.
So I guess the thinking, I mean, as I say, we're not in a position to clarify that at this stage because we're looking at that. But I guess the thinking would be that this would be for new When I'm Ready provisions moving forward, so that we would start. So it wouldn't impact on what is already in place for our current providers, but this would be something that we would be looking for new providers moving forward.
Yeah, that's clear now. Councillor Baker?
I was going to ask the difference between the one standard rate, if you're going to take it back, just as you said, Chair. But I can't get my head around it. Will it be in between what you are already offering, between the enhanced rate and the support? Would that new rating you're looking at be within the middle of that, or at the enhanced rate? I'm really confused, just like Chair. I'm very sorry.
So again, just to sort of reiterate that we're looking at the finance, what that would look like. We know that obviously there have been uplifts to the When I'm Ready provisions over the last couple of years. So we're looking at what a reasonable and fair rate would be. So it could be that it falls in between the two rates. It could be that it's slightly higher than the current enhanced rate. But at the moment, I'm not able to share clear figures on that. But it certainly we won't be seeking to create any any detriment to our When I'm Ready providers in the respect of what they are getting financially.
Okay, thank you on that. I was going to say something else, but it's gone out of my brain now. But would we then be saving as a council by them going on this new rate? Would we be saving, or wouldn't we? Or will we be cutting even?
I don't know whether I can answer that directly, but what I guess
okay, that's okay.
No, it's fine. I suppose just to reiterate, it would enable us to financially forecast much more clearly than we have been able to do up to now, because we've had two different rates, whereas we would be looking to have one standardised rate that would enable us to be far more clear in terms of our financial forecasting.
Okay, thank you.
Just to add to what Helen just said, and that you made the point earlier. I mean, I think it's, if you think about it beyond financial elements, it offers the stability that it could offer young people, and them not being worried about where they're going to live when they're 18. That's probably not measurable in financial terms, but what it would do, it would mean potentially that they may not need to go into maybe higher cost provision, because which might not be suitable. They can actually stay within a family setting, which in terms of their emotional well-being, and then being able to go on with their life, whether it's study or work or training. I think that's probably the better outcomes for young people. So we would hope that more people would want to consider this as an arrangement for care experience young people, because it would deliver for the majority of them better outcomes when we think about their circumstances. Sorry, Councillor.
I don't disagree with you on that. I don't disagree on that. They do deserve a better outcome on things as well. And we do put our children first, and even our young adults first in our lives. So I do agree. So, sorry, I had to ask the question, that's all. Thank you, Chair.
Thank you, Councillor Baker. Just out of curiosity now, is there somebody else? Oh, sorry. I'm so sorry.
You might want to make your point first, Chair, and I'll come in at the end if that's okay.
All right, thank you. Just out of curiosity, really, nothing else, I was just looking at the rates and just wondering why there was such a significant difference between the enhanced support rate and the standard support rate.
I don't know. I'm going to see if Amy might want to come. She's smiling at me now. I don't know. Amy, is there any?
So the standard rate was the minimum. It kind of the payment should be in the guidance, and then the enhanced rate was set at that rate originally because it was the same rate as what fostering allowance was. So it meant that young people were in that academic year weren't needed to move before they finished their kind of college year or school year, because there was less impact on foster carers. So it was just put in place for just to get them to the end of that August so that they finished their school year if their birthday was kind of during term time.
Okay, thank you. Just as I said, it was just out of curiosity. On to you, Dave.
It does point to this in the report, but I just want to make sure that we're clear. The committee isn't able to make a decision about whether the council should do this or not. It's not a decision that falls within its remit. I think what Helen was looking for was, again, does this look like the right direction of travel? So do we think the logic that's being put forward here that then will need to be taken for either a CMT decision, or it might even be a cabinet decision around fee setting going forward? Does it look as if this is likely to enhance a better offer for our young people, making it more, and carers, to making it more likely that we'll be able to facilitate more when I'm ready placements, which has already been described by some of the councillors? Well, that's absolutely something we would support and something that we would want, and it's absolutely fits with our target operating model for children's services, you know, be able to support more children for as long as they need to be supported within families, etc., etc. So I think it's more of a steer on, do we support the direction of travel here? Because a technical report's going to have to be taken somewhere else, including with the, you know, the accurate financial information, etc., etc., etc. And then the decision will have to be made under the financial rules of the council. For the purposes of the committee, does it look like this is the right direction of travel? Do we support the idea of simplify the scheme, pay as enhanced a rate as we can overall, keep it simple, provide clarity for future carers, you know, try and encourage as many placements as possible? Do all of those things seem to fit with the logic? And does the committee support that, so that by the time we then have to take a technical report, we can say, this committee considered it, they raised these sorts of considerations to be taken into account at the point that decision's been made? That kind of thing, Chair, if that's helpful.
That's very helpful. And well, I think particularly I support the whole idea, you know, for the reasons that are put forward, including the fact that, you know, it takes the pressures off of housing as well. And the safety, of course, as Councillor Baker mentioned earlier on, the safety of the young people themselves and the fact that they remain in that environment that they've been used to. So there are a lot of benefits to it. Councillor Yvonne Jardine.
Thanks, Chair. I just wanted to say that I support this wholeheartedly, and a lot of the things that Dave was just saying, I can remember back before I became a councillor, young people left care and ended up in the bed and breakfast on Oystermouth Road and generally around Swansea. And that was the catalyst really for the encouraging our foster parents to keep the youngsters in until they either went to uni or got settled. Or so yes, with whatever the cost, I think all round it's better for the young people and better for Swansea as a whole. Okay, thanks, Chair.
Thank you. Anybody else got anything to say? Anything to add? Any questions? Nope. Okay. Well, again, only left for me to say thank you very much for that report. And both reports are very, very powerful. And we do support, you know, both reports 100%. Going back to the agenda now, the next item is the work plan 2025-2026. A copy of which you will find on the back page of the agenda pack on page 14. So our next meeting is on the 13th of October, and we will be looking at foster carer support, digital inclusion, and the Swansea Council volunteering policy. November, you would see the topics coming up there. Transition, you know, with a focus on promoting independence of vulnerable young adults. Tackling poverty strategy. In January, we've got the forward planning for Cuchmaur. In February, we've got early years childcare expansion, and then on to March, where we have the substance misuse, looking at the recommendations of the Western Bay Drugs Commission. And then beyond that, I think is left to be discussed then when that time comes. So as I said earlier on, our next meeting is on Monday, the 13th of October, 2025 at 4 p.m. And if there's nothing else to discuss, Dave, you want to come in? Yes.
Sorry, Chair, I'm being really annoying today. Just to, there's been some communication with the chair about feedback from the PPA, which had one of the recommendations for improvement was for the service transformation committees to be clearer about the end state of transformation, given that these are transformation committees. So a couple of times today, Cabinet member and others have referred to target operating models that we're working towards in adult services, in children's services, and the way we work with and in communities. So we think we have pretty clear target operating models. I referred to them in the report that I gave to council last week. But that's not the case necessarily across all of the areas of the council. So all of the service transformation committees have been asked to, can you make sure that you are clear about your end states that you are overseeing as part of the work plan and the work programme? And I suppose I just wanted to check, whilst we're referring to target operating models and then items that are on your work plan are consistent with those target operating models, you haven't actually had an overall description of what are those end states. So I just wanted to check, do you feel the need as a committee to have an overview of the end state? So what is in 3 years' time, what will adult services look like? What will children's services look like? What will our work look like in the way that we work with and in communities? Do you want something like that as part of your work plan? Or are you happy as a committee that you've got a good enough understanding of it's more prevention, it's less managed care, it's more co-production, etc., and that you're happy that the items you're looking at are part of that? So I just wanted to check, because at some point the overall committee is going to come back to us and say, well, what is the end state? And you're happy we're just going to present, well, it's these target operating models, without the committee having necessarily had a session on, well, exactly what is it in the way that we, as best we can describe it at the moment. So I just wanted to check that out with you before you signed off your work programme, because it isn't on there at the moment.
That's a very good observation. And I would say the simple and straightforward answer to that is, yes, we would benefit, from a session where we actually know what the end target looks like, what the success of everything that we've done, through the work of not just this committee, but the other transformation committees as well would look like. I mean, because I believe that the whole essence, of these meetings is for us to ensure that we're working together, or the council is working towards long-term, outcomes for the people that they support. So for us to just ask questions and gain understanding is not enough. We need to know what, as you said, in 3 years' time, what would this policy look like, out there in the committee, away from what's on paper, what's implementation really going to look at? Will people actually benefit from it? I think that's the long term, and which is one of the 5 ways of working of the Future Generations Act, isn't it? I don't know if other members have anything they would like to add to that. Nope. No, so yeah, definitely we would, benefit at some point, later we would sit down and look at the work plan again and see how we can.
So I guess it's the timescale that you might want to do that. At the moment, you seem to have some space towards the end of this financial year. So whether we leave it till then, or whether you want to rejig it, and I wouldn't say do it next month, because that'll create loads of work for people that they won't have had time to necessarily do to bring something coherent. But we could do something towards the end of the calendar year if you wanted to rejig the agenda, push the things that come after that back a month. We could perhaps do something then. Then you're doing it fairly timely, given that you're already taking items. So a choice really for you as a committee, either something at the end of this calendar year or something at the end of this financial year. Either one are happy. We'd be happy to bring.
Yeah. Well, I'm just, go on.
Sorry, Dave, because we were under the impression, Democratic Services, that these topics, if it's part of the PPA, was to come to October meetings for all the STCs, or is that something different?
Well,
Because then there's a report going to Cabinet in December.
Where's the discussion about the STC? I mean, us having this conversation today, as far as I'm concerned, is, well, we've done the first bit. Yeah, it's a bit more complicated to say, are you going to have a full session on all of the stuff to be able to properly iterate it? If I'm asked at the moment, I'm going to be saying it's the target operating models that we've already set budgets for, et cetera, that, you know, we're in a better. More for me is, does the committee understand the 3-year vision? When I'm talking in council last week and saying in 3 years' time the world's going to look like this, really this committee should already know that, but I'm not sure it does. That's really the issue for me. So I think it's okay. We could either do something towards the end of this calendar year or something towards the end of the financial year. You can trust that all of the items, as was evidenced today, there was loads of reference, wasn't there, to we're doing this prevention stuff in adults because it fits with our target operating model. The committee asked all the right questions. So it's not something I don't think for this committee to worry about. I do think there is something, as you described rightly, Chair. No, we could do with a session on, once you pull it all together, what would it look like in an ideal world? I think that will be a good session. It's just the timing of it. Do you want it in December, in which case you need to rejig your work plan, or do you want it at the end of the financial year? Either are fine.
He was going to do like a special or a workshop or something like that.
Right, okay. So looking at the work plan at the moment, we don't have a meeting in December. So end of the calendar year. So end of the financial year. So we're looking at around March. We've got the substance misuse. I mean, in January, we've got Kuchma forward planning. That's well, I'm hoping that's, you know, we might be able to fit something around there, either that or in February when we do the early years childcare expansion. But then again, you know, there's always, you know, room to discuss this again next month in the next meeting.
Early January, February time will fit actually, because there'll have been some early preparation around budgets, etc., so that might work nicely. And at the moment, we'll just respond. If we're asked again, we'll respond saying it's target operating model for children's services, adult services, working within communities. You know, so we've got an answer if we're asked. What's the committee working on? It's those things. You then do the detailed stuff in January or February. That's fine.
Jane.
Sorry, Chair, thanks. They're sort of my items. They do fit in with exactly what Dave's just described. We could combine them together and work on the agenda, on the work plan with you guys. Are happy to do that. I think it can all work. I think early January, February, it kind of fits in with the whole budget setting process that ends up going through full council and scrutiny, and actually understanding where we're going to, and how all of the things we have looked at fits into that agenda. I think we're good.
Okay, perfect. Looks like we have a plan. So should we leave it to the officers then, to go back and rejig things and then let us know then in the next meeting. All right. Yeah. If there's nothing else, I would say thank you very much for coming to the meeting and see you all again soon.
Thanks
Thank
all.
you. Bye. Bye.